Here's a startling number. 28 million people in the United States alone suffer from migraines. There's no cure for the sickness, but it can be treated and in some cases prevented. Dr. Richard Wittenborn, who is a neurologist with Somerset Medical Center, is here with information on battling the attacks. Thank you so much for being here, Dr. Wittenborn.
Well, thank you for having me.
I think there's a lot of confusion out there when we say migraines, the confusion between what's a migraine and what's a headache, and how do they differ?
Well, all migraines are headaches, but not all headaches are migraine. Migraine has a fairly formal definition according to the standards of the International Headache Society. But from a layperson's perspective, typically you're looking at a severe throbbing headache, often associated with nausea. You're sick to your stomach. Mm-hmm. You may have a sensitivity to light and noise, and it's the headache that puts your friend in a cold, dark room, complaining bitterly if anybody disturbs them.
Yeah, I was explaining to Dr. Wittenborn that my Aunt Dee suffers from migraine headaches, and she's been at points where, and that's something that I'm interested in knowing, because she's got, beyond the headache, some things that you were mentioning, sometimes discomfort in her stomach, and also a light that flashes in front of her eyes, and those are all symptoms, and I know there's more that also differentiate a migraine from a headache. Well,
when people use the term headache, most of them are referring to what would be diagnosed as tension-type headache. And probably 85% of people have this. Mild, dull headache, often coming on at the end of the day.
So an example might be after a stressful day at work,
sure.
You come home and you've got a headache, or during the day.
You got a bad guest and you're sitting there going, what am I going to do?
What am I going to do? Oh my goodness, my head's killing me.
As opposed to these headaches, which really interfere with your life. And we all recognize the person who has to go to bed, but part of the burden is the person who continues to stay on the job and struggles through but just doesn't produce anything that day. And that's part of the hidden economic cost of this.
Really?
Ghost workers.
It is debilitating, and is there appropriate sympathy, I guess I want to say, for people who suffer from migraines, from those who never have suffered from them? And I keep saying the difference between headache and migraine, and I understand that migraine is a type of headache. It's a classification. But I guess what you were talking about, the difference between that stress headache, where you've got an ache in your head, and a full-on migraine.
Well, of course, the question is sympathy from who?
Understanding.
Sympathy from your physician, sympathy from your community, your friends, sympathy from your employer, sympathy from your insurance company. Probably if I were going to rank order those, your friends probably have the most sympathy. Hopefully your doc next.
I hope so. I thought you were going to say doc first.
Your employer third, and your insurance company clearly last.
That's interesting.
They don't really do a terribly good job of providing coverage for this kind of care.
Is it difficult to diagnose a migraine? Is it important to go to a doctor and have it diagnosed?
Well, yes and no.
Okay.
The problem is that the characteristic symptoms are pretty straightforward. Then there's always this little caveat or warning that you have to exclude underlying conditions that are potentially serious. Now, if you've had the same headache for 10 or 15 years, it is unlikely that this represents anything terrible. But if you've had them for a few weeks or a few months, then it could easily be something that's much more serious.
So it's important to get to your doctor and talk to them whenever you have new pain come up or new discomfort.
Or if your headache pattern changes.
Oh,
okay. You have a person who has migraine, well, it doesn't prevent anything else. So a migraineur may develop some condition that has headache as a principal symptom, and they'll think that, oh, it's just a variant on what I've got.
Sure.
But usually if you've had migraine for some time, you should recognize it. headache may not be an old familiar friend, but it's
Right.
old and familiar.
Yeah.
And if it's something different,
You know, I'm thinking there's probably someone at home right now who's going, you know, that sounds like me. I've had these, this pattern's changed, this is debilitating for me. And it's important to go to the doctor. How can they prepare for that doctor's visit?
well, you know, basic information. When you
Like
think
what?
about your headaches, often people think about how it's disrupted their life. You know,
Sure.
the price they've paid in terms of disrupted plans, interfered with relationships, compromised work situation.
Sure.
But what your doc needs is concrete information.
Like
Where does
what?
it hurt? What does it feel like? How does it change? How long does it last? How often does it come?
And as specific as you can be, you know, where does it hurt to be able to reference exactly where the pain is radiating from? How long does it last, as close as possible to know, you know, 1 hour, 15 minutes, 3 hours, that type of thing will be helpful for the doctor?
And there's always the temptation, and I do this too, when you finally have something that's got your attention enough that you go to the doc, you tell them about the last 2 things you had, and not give them the pattern of how this has existed over the last year or 2 or 3.
So track the pattern. Write down every time you have a headache and make some notes to yourself. What day, what time of day. Because are there triggers? I've heard that there can be, or it's thought that there's migraine triggers out in the world.
Well, there are a whole host of things that cause some people with migraine to have a headache more frequently. And they range from foods, notoriously alcohol, or preserved meats where there are nitrates. Some people have psychosocial stress-related headaches. They'll have headaches sometimes with the onset of a stress.
Sure.
They're coming up on an exam, they get a headache. Sometimes they have letdown headaches after all the excitement's over.
So being able to track that will allow you to realize whether there are triggers. Now, if I'm suffering from symptoms, or someone at home right now is suffering from symptoms, are there treatments available today?
Oh, there's a lot you can do. Depends a bit on where you are in the context of the headache. So if it's just starting, there are a group of drugs that have been available over the last 15 years or so, generically called the triptans, which are pretty marvelous. And
The triptans. Okay.
and
Is that a pain reliever or?
Actually, no. The nice thing about this is that it goes directly at one of the mechanisms of migraine. It goes at the serotonergic nervous system. Serotonin is one of those neurochemicals that allows one nerve cell to talk to another. And it goes right at the target without giving you all the side effects of pain medication.
Oh, really? So there are options. What other treatments are there? You said if the headache's coming on, is there anything preventative for migraines right now?
Prevention is less important because the triptans are so good.
Ah, I see.
But certainly there are a variety of medications that have been actually developed for other purposes. So some of them are blood pressure medications, some of them are antidepressants.
And we've discovered one of their side effects is the alleviation of migraines?
What happens is that you
Interesting.
give them to the person who has the primary issue, and then they come back and say, oh, by the way, you know, I haven't had my headaches.
Oh.
There was even a study of aspirin in middle-aged male physicians, and they discovered that an aspirin a day decreased the self-reported incidence of migraine among these people.
Excellent.
So it's all sort of incidental.
So our key areas here, because I know we're almost out of time, is just to remember that it's okay, there is a difference between migraine and headache. Track the symptoms that you're having. Make sure you write it down. Bring a history to your doctor. Don't be afraid to go to your doctor. And that there are treatments available today, either when you're getting the headache or to be able to avoid certain triggers. Dr. Wittenborn, thank you so much for being here today. I appreciate it.
You're welcome.
Thank you.